Breast cancer remains one of the most significant health challenges worldwide, particularly for women. Affecting millions each year, it is a disease that not only impacts the physical health of patients but also their emotional and mental well-being. With high mortality rates and the ability to spread to other parts of the body, the need for innovative, effective and less invasive treatments is greater than ever. The quest for better solutions is ongoing, driven by the hope of reducing the suffering and improving the survival rates of those affected. Traditional chemotherapy, while life-saving for many, often comes with harsh side effects: nausea, fatigue, hair loss, and even long-term complications such as heart problems or neuropathy. These side effects can be debilitating, making the treatment process almost as challenging as the disease itself. Although it plays a critical role in breast cancer treatment, it is far from perfect, leaving room for new therapeutic advancements. The medical community continues to search for treatments that are not only effective, but also kinder to the patient's body. Today, we explore a groundbreaking approach that offers new hope: photothermal therapy, or PTT, assisted by Gold Nanorods. This innovative method is at the forefront of cancer treatment research, promising a future where cancer can be treated more effectively and with fewer side effects. In a recent study, researchers introduced an innovative method utilizing polyvinyl pyrrolidone-capped gold nanorods, combined with a near-infrared laser at 808 nanometers, to treat breast cancer in laboratory models. This combination has shown remarkable potential in targeting and destroying cancer cells. Why 808 nanometers? This specific wavelength is chosen for its unique properties. This wavelength offers deep tissue penetration, precise targeting, and minimal absorption by healthy tissues. It ensures that the treatment reaches the cancer cells effectively while sparing the surrounding healthy tissues from damage. When gold nanorods absorb this laser light, they convert it into heat, effectively destroying cancer cells while sparing healthy ones. The results are remarkable, showing a significant reduction in tumor size and cancer cell viability. In a study involving 42 rats with induced mammary cancer, tumors in the treated group shrank by over 75%. This dramatic reduction highlights the potential of this therapy to make a real difference in cancer treatment. Histological analysis revealed tissue regeneration, while biochemical markers like carcinoembryonic antigen and estradiol showed significant improvements. These findings suggest not only the destruction of cancer cells, but also the promotion of healing and recovery in the affected tissues. And here's the best part: this photothermal therapy achieved these results in just 2 weeks, a fraction of the time required for traditional treatment. This rapid response is a game changer, offering patients a quicker path to recovery. This innovative technique, combining gold nanorods and NIR lasers, is a beacon of hope for breast cancer patients. It represents a significant step forward in the fight against cancer, providing a new avenue for treatment that could improve outcomes and quality of life. By reducing the need for aggressive treatments and improving recovery times, it could redefine cancer care as we know it. The future of cancer treatment looks brighter with such promising advancements on the horizon. Stay tuned as I delve deeper into this revolutionary research and its potential to change lives. We will continue to explore the science behind this treatment and its implications for the future of cancer care. Thank you for watching the For Science Salah Lotfy channel. Your support helps us bring more groundbreaking research to light.
Welcome to For Science Salah Lotfy channel. Today we have an exciting topic that could revolutionize the way we treat cancer. Today I'm super excited to dive into a groundbreaking study titled A New Vision of Photothermal Therapy, Assisted with Gold Nanorods for the Treatment of Mammary Cancers in Adult Female Rats. This study is not just another piece of research, it represents a significant leap forward in the field of cancer therapy. This research offers a promising step forward in the field of cancer therapy using nanotechnology. Imagine a world where cancer can be treated more effectively with fewer side effects. That's the potential impact of this study. This remarkable study was published in the prestigious journal Nanoscale Advances, issue 1 of 2024. Being featured in such a reputable journal underscores the importance and credibility of this research. It highlights the innovative potential of photothermal therapy combined with gold nanorods. Sounds intriguing, right? But what exactly are gold nanorods and how do they work in cancer treatment? Now let's meet the brilliant minds behind this study. These researchers have dedicated their careers to pushing the boundaries of science and medicine. First up, we have Professor Walid Tawfik, an expert in laser spectroscopy and ultrafast lasers. His work is crucial in understanding how lasers can be used to target cancer cells precisely. He heads the Department of Laser Applications in Metrology, Photochemistry, and Agriculture at the National Institute of Laser Enhanced Sciences, or NILES. His leadership and expertise have been instrumental in this study. Then there's Professor Heba Mohamed Fahmy, an associate professor of biophysics at the Faculty of Science, Cairo University, who contributed her expertise to this research. Her insights into the biophysical aspects of cancer treatment are invaluable. Dr. Hend Gamal, a dedicated researcher from the Department of Zoology at Mansoura University, played a key role in the experimental design and execution of this study. Dr. Ahmed N. Emam, from the Nanomedicine and Tissue Engineering Research Lab at the National Research Center in Daki, Cairo, Egypt, brought his expertise in nanomedicine to the table, helping to bridge the gap between nanotechnology and practical medical applications. Professor Dr. Heba Atef El-Ghaweet, a specialist in experimental embryology from the Department of Zoology at Mansoura University, contributed her knowledge on the biological impacts of the treatment. And lastly, the late Professor Hassan El-Sayad, also a professor of experimental embryology at Mansoura University. His pioneering work laid the foundation for many aspects of this research. This research is dedicated to his memory and legacy. His contributions to science continue to inspire and drive forward new discoveries. This interdisciplinary team combined their expertise in laser applications, biophysics, nanomedicine, and embryology to advance photothermal therapy techniques using gold nanorods. Their collaborative effort showcases the power of interdisciplinary research in solving complex medical challenges. Their work not only contributes to scientific innovation but also holds promise for improving cancer treatment outcomes. The potential to save lives and reduce suffering is what makes this research so impactful. Thank you for joining me on this journey into cutting-edge science. Your curiosity and support help drive the quest for knowledge and innovation. Make sure to like, share, and subscribe to For Science Salah Lotfy channel for more inspiring scientific discoveries. The fight against cancer has been a long and arduous journey for humanity. For decades, we've battled this formidable foe with a variety of weapons, from surgery and radiation to chemotherapy and immunotherapy. Each of these treatments has brought us closer to understanding and combating this complex disease, but they also come with significant challenges and side effects. We've made progress, but the need for more effective, less invasive treatments remains urgent. Traditional methods, while sometimes effective, often leave patients with debilitating side effects that can severely impact their quality of life. The quest for a better solution has led researchers to explore new frontiers in science and medicine. Now, a new champion is emerging from the world of nanotechnology: gold nanoparticles. These minuscule particles, invisible to the naked eye, are being hailed as a potential game-changer in the fight against cancer. Their unique properties allow them to interact with cancer cells in ways that were previously unimaginable. These tiny golden warriors hold immense promise for revolutionizing how we diagnose and treat cancer, offering a beacon of hope to millions worldwide. By leveraging the special characteristics of gold nanoparticles, scientists are developing innovative techniques to target and destroy cancer cells with unprecedented precision. Imagine a world where cancer treatment is no longer synonymous with debilitating side effects, where patients can undergo therapy without the fear of severe nausea, hair loss, or fatigue. This vision is becoming increasingly attainable as research into gold nanoparticles progresses. Picture a future where tumors can be targeted with pinpoint accuracy, leaving healthy tissue unharmed. This level of precision could drastically reduce the collateral damage often associated with conventional cancer treatments, leading to faster recovery times and improved overall outcomes for patients. This is the promise of gold nanoparticles. Their ability to be engineered at the molecular level means they can be customized to seek out and destroy cancer cells while sparing healthy ones. This targeted approach not only enhances the effectiveness of the treatment, but also minimizes the adverse effects on the patient's body. These nanoparticles possess unique properties that make them ideal for cancer therapy. Their small size allows them to penetrate deep into tissues, and their surface can be modified to attach to specific molecules found on cancer cells. This specificity is what makes them such a powerful tool in the fight against cancer. They can absorb light and convert it into heat, a phenomenon we can harness to destroy cancerous cells. This process, known as photothermal therapy, involves directing light at the nanoparticles, which then heat up and kill the surrounding cancer cells without harming the adjacent healthy tissue. They can also be engineered to deliver drugs directly to tumor sites, minimizing damage to healthy tissues. This targeted drug delivery system ensures that the medication is released exactly where it's needed, increasing its efficacy and reducing the likelihood of side effects. The future of cancer treatment might just be golden. As we continue to explore and refine the use of gold nanoparticles, we move closer to a world where cancer can be treated more effectively and with fewer side effects, offering new hope to patients and their families. In the realm of nanomaterials, gold stands apart. Its unique properties have fascinated scientists and researchers for decades, making it a subject of intense study and numerous applications. But what exactly sets gold apart from other nanomaterials? Why gold, you might ask? The answer lies in its remarkable combination of chemical and physical properties. Gold nanoparticles exhibit a level of stability and inertness that is unparalleled by other materials. Why not silver or other intriguing elements? Silver, for instance, is known for its excellent antimicrobial properties, making it a popular choice in various applications. However, when it comes to biocompatibility, gold takes the lead. Well, gold possesses an inherent inertness that makes it incredibly biocompatible. This means it can interact with biological systems without causing adverse reactions, a crucial factor for any medical application. Its inertness ensures that it remains stable and does not react with other substances in the body. This means it's less likely to trigger harmful reactions within the human body, a crucial factor for any medical application. In medical treatments, the safety and compatibility of the material used are of utmost importance. Gold nanoparticles have been shown to be safe and effective in various medical applications, from drug delivery to imaging. Silver nanoparticles, while possessing antimicrobial properties, tend to be more reactive. This reactivity can be a double-edged sword. On one hand, it makes silver effective in killing bacteria and other pathogens. On the other hand, it can lead to unwanted side effects when used within the delicate environment of the human body. This reactivity, while useful in some contexts, can lead to unwanted side effects when used within the delicate environment of the human body. The reactivity of silver can cause damage to healthy cells and tissues, leading to inflammation and other complications. Gold-coated silver nanostructures, while attempting to combine the best of both worlds, face their own challenges. The idea is to harness the antimicrobial properties of silver while mitigating its reactivity with a protective gold coating. However, this approach is not without its issues. The stability of the gold coating can be an issue, potentially leading to the exposure of the more reactive silver core. If the gold coating degrades or is damaged, the underlying silver can become exposed, leading to the same reactivity issues that pure silver nanoparticles face. Gold, in its pure and pristine nanoparticle form, emerges as the clear victor. Its stability, biocompatibility, and unique properties make it an ideal candidate for a wide range of applications. From medical treatments to electronic devices, gold nanoparticles are proving to be invaluable. Its biocompatibility, combined with its unique optical and thermal properties, makes it the gold standard for nanomedical applications. Gold nanoparticles can be used for targeted drug delivery, allowing for precise treatment of diseases with minimal side effects. They also have unique optical properties that make them useful in imaging and diagnostic applications. In the world of nanomaterials, gold truly stands apart as a versatile and valuable resource. Now let's talk about keeping these golden warriors stable and ready for action. Enter polyvinyl pyrrolidone, or PVP for short. PVP is a polymer, a long chain of repeating molecules that plays a crucial role in the world of gold nanoparticles. Imagine PVP as a protective shield, enveloping each individual nanoparticle and preventing them from clumping together. This capping action is essential. When gold nanoparticles aggregate or clump, they lose their unique properties, rendering them ineffective for targeted cancer therapy. PVP ensures that these nanoparticles remain dispersed and individually active, ready to target cancer cells with precision. It's a vital component in the recipe for success when it comes to gold nanoparticle-based cancer treatments. Section 4. Photothermal therapy, harnessing light's healing power. Light, the very essence of life on Earth, can also be harnessed as a powerful tool against cancer. This concept, though seemingly futuristic, is grounded in solid scientific principles and ongoing research. The idea is to use light not just for illumination, but as a precise instrument to target and destroy malignant cells. Photothermal therapy, or PTT, exploits the unique interaction between light and matter to selectively destroy cancerous cells. This method leverages the properties of certain materials, like gold nanoparticles, which have a high affinity for absorbing light and converting it into heat. Here's how it works. Gold nanoparticles, when exposed to specific wavelengths of light, particularly near-infrared light, absorb the light's energy and convert it into heat. This process is highly efficient, making gold nanoparticles ideal candidates for this type of therapy. This heat, concentrated around the nanoparticles, becomes lethal to nearby cancer cells while leaving surrounding healthy tissue unharmed. The precision of this method is one of its greatest advantages, as it minimizes collateral damage and focuses the therapeutic effects exactly where they are needed. Near-infrared light is ideal for this purpose because it can penetrate deep into human tissue without causing damage. This characteristic allows the light to reach tumors located deep within the body, making it a versatile tool in the fight against cancer. It's like shining a flashlight through a hand. The light passes through, but the heat generated by the gold nanoparticles remains localized, effectively cauterizing the tumor from within. This innovative approach holds promise for more effective and less invasive cancer treatments, potentially transforming the landscape of oncology. Section 5. Shining a light on PVP-capped gold nanorods. Gold nanoparticles come in various shapes and sizes, each with its own unique properties. Among them, gold nanorods capped with our trusty PVP have emerged as particularly promising candidates for photothermal therapy. These tiny, rod-shaped structures are like miniature antennas, exceptionally efficient at absorbing near-infrared light and converting it into heat. Recent studies have demonstrated their effectiveness in preclinical models, paving the way for potential breakthroughs in cancer treatment. Researchers have meticulously crafted and tested these PVP-capped gold nanorods, demonstrating their ability to effectively target and destroy cancer cells in laboratory settings. These studies provide a glimpse into a future where photothermal therapy using gold nanorods might become a standard weapon in our arsenal against cancer.
Imagine you're a researcher studying the effectiveness of 3 different types of antidepressants. You want to find out which one works best for reducing symptoms of depression. You have 3 groups of participants, each receiving a different antidepressant. Each group is carefully monitored to ensure they follow the treatment protocol. After a set period, you measure their depression levels using standardized surveys and clinical assessments. You want to know if there are any differences in the effectiveness of the antidepressants. Are some medications more effective than others, or are the differences negligible? This is where one-way ANOVA comes in. ANOVA stands for Analysis of Variance. It's a statistical test used to compare the means or averages of 2 or more groups. One-way ANOVA specifically looks at the effect of one independent variable, like the type of antidepressant, on a continuous dependent variable, such as depression levels. It helps to determine if the observed differences are statistically significant. The one-way refers to the fact that we are only looking at the effect of one independent variable. In our case, it's the type of antidepressant. The independent variable has 3 levels, which are the 3 types of antidepressants. Each level represents a different group in your study. ANOVA helps us determine if the differences in depression levels between the groups are statistically significant or simply due to chance. In essence, one-way ANOVA helps researchers answer questions like, is there a difference in the average depression levels of people taking different types of antidepressants? Are the results meaningful enough to influence clinical decisions? It's a powerful tool for comparing groups and drawing meaningful conclusions from data. By using one-way ANOVA, researchers can make informed decisions about the effectiveness of different treatments. SPSS, or Statistical Package for the Social Sciences, is a widely used software program for statistical analysis. It provides a user-friendly interface and a comprehensive set of tools to analyze and interpret data. For researchers and students dealing with statistical analysis, SPSS is an invaluable resource. When it comes to conducting a one-way ANOVA, SPSS simplifies the process significantly. It takes care of the complex calculations and presents the results in an easy-to-understand format. With SPSS, you can easily input your data, select the variables you want to analyze, and run the one-way ANOVA test. SPSS also offers various options for customizing your analysis, such as choosing different post-hoc tests or adjusting for multiple comparisons. Its intuitive interface and comprehensive features make it an ideal tool for conducting one-way ANOVA and other statistical analyses. In statistical analysis, we often talk about probability levels or p-values. These values are crucial in determining the significance of our results. The p-value represents the probability of obtaining the observed results if there were no real effect. Essentially, it helps us understand the likelihood that our findings are due to random chance. In simpler terms, it tells us how likely it is that the differences we see between groups are due to chance. This is a fundamental concept in hypothesis testing. A commonly used threshold for statistical significance is p less than or equal to 0.05. This threshold helps researchers decide whether to reject the null hypothesis. This means that there is a 5% chance or less that the observed results are due to random variation. In other words, the results are unlikely to have occurred by chance alone. If the p-value is less than 0.05, we reject the null hypothesis, which states that there is no difference between the groups. This rejection indicates that there is a statistically significant difference. Here's a breakdown of probability levels and their interpretations. Understanding these levels helps in making informed decisions based on statistical data. Non-significant p greater than 0.05-. The results are not statistically significant, meaning there is no strong evidence to suggest a difference between the groups. This often leads to the acceptance of the null hypothesis. Significant p less than or equal to 0.05-. The results are statistically significant, suggesting a real difference between the groups. This indicates that the observed effect is unlikely to be due to chance. Highly significant p less than or equal to 0.01-. The results provide strong evidence of a difference between the groups. This level of significance is often used in more stringent research settings. Very highly significant p less than or equal to 0.001-. The results provide very strong evidence of a difference between the groups. This level is used when researchers need to be very confident in their findings. Understanding probability levels is crucial for interpreting the results of statistical tests like one-way ANOVA. These levels guide researchers in making decisions about their hypotheses. It helps us determine the strength of the evidence and draw meaningful conclusions from our data. By comprehending these levels, we can better understand the implications of our research findings. Section 4, Step-by-Step One-Way ANOVA in SPSS, Unlocking Group Differences. Let's walk through the steps of conducting a one-way ANOVA in SPSS using our example of antidepressant effectiveness. This statistical test helps us determine if there are any statistically significant differences between the means of 3 or more independent groups. First, you would enter your data into SPSS. This involves inputting your collected data into the software, ensuring each data point is accurately recorded. Each row represents a participant and each column represents a variable, for example, group and depression score. It's crucial to label your columns clearly to avoid any confusion during analysis. Next, go to the Analyze menu, select Compare Means, which will allow you to compare the average scores of different groups, and then choose One-Way ANOVA. This option is specifically designed for comparing the means of 3 or more groups. In the One-Way ANOVA dialog box, you'll set up your analysis by specifying your dependent and independent variables. Move the dependent variable, which is the depression score, into the dependent list box. This tells SPSS what outcome you're measuring, and an independent variable, which is the group, into the factor box. This indicates the different groups you're comparing. Click on the Options button to select additional statistics, such as descriptive statistics, which provide a summary of your data, or a homogeneity of variance test. This test checks if the variances across the groups are approximately equal, which is an assumption of ANOVA. Finally, click OK to run the one-way ANOVA. SPSS will process your data and perform the analysis. SPSS will generate output tables summarizing the results. These tables provide detailed information about your analysis. The output tables will show you the F statistic, degrees of freedom, and the p-value. These are key metrics in understanding your results. The F statistic measures the variance between the group means relative to the variance within the groups. A higher F statistic indicates a greater difference between group means. The p-value tells you the probability of obtaining the observed F statistic if there were no real differences between the groups. A low p-value suggests that the group differences are statistically significant. Section 5. Beyond ANOVA, Tukey HSD. Post hoc test for specific comparisons. If the one-way ANOVA indicates a significant difference between the groups, we need to determine which specific groups differ from each other. This is where post hoc tests come in. Post hoc tests are conducted after the ANOVA and allow for pairwise comparisons between the groups. One commonly used post hoc test is the Tukey Honestly Significant Difference, or HSD test. Tukey HSD controls the family-wise error rate, which is the probability of making at least one type 1 error or rejecting a true null hypothesis across all the pairwise comparisons. The Tukey HSD test compares the means of all possible pairs of groups and provides p-values for each comparison. If the p-value for a pairwise comparison is less than 0.05, then we conclude that there is a significant difference between those two groups. Section 6, One-Way ANOVA, in action, real-world examples. Let's look at some real-world examples to illustrate how one-way ANOVA can be used. First, in education, a researcher wants to compare the effectiveness of 3 different teaching methods: lecture-based, online, and blended learning on students' exam scores. They could use a one-way ANOVA to determine if there is a significant difference in exam scores between the 3 groups. Next, in marketing, a marketing team wants to test the effectiveness of 4 different advertising campaigns on product sales. They could use a one-way ANOVA to compare the average sales figures for each campaign and identify the most successful one. Lastly, in healthcare, a study investigates the impact of 3 different exercise programs on blood pressure in patients with hypertension. One-way ANOVA can help determine if there's a significant difference in blood pressure reduction among the groups. These examples highlight the versatility of one-way ANOVA in various fields. It allows researchers to make informed decisions and draw meaningful conclusions from their data. Section 7. Conclusion: the importance of one-way ANOVA in research. One-way ANOVA is an essential statistical tool for researchers across disciplines. It provides a robust method for comparing the means of 2 or more groups and determining if the observed differences are statistically significant. By understanding the basic concepts of one-way ANOVA, the interpretation of probability levels, and the use of post hoc tests like Tukey HSD, researchers can effectively analyze and interpret their data. Software packages like SPSS simplify the process of conducting one-way ANOVA, making it accessible to researchers with varying levels of statistical expertise. From education to marketing to healthcare, one-way ANOVA plays a crucial role in advancing knowledge and making informed decisions based on data analysis. By embracing this powerful statistical tool, researchers can unlock valuable insights and contribute to a deeper understanding of the world around us.
Hey there, science fans! Today we're diving into the incredible world of nanotechnology to see how tiny gold particles are making a big impact in the fight against cancer. We're talking about gold nanorods, folks, and these little guys are revolutionizing cancer treatment. But how can gold, a shiny metal, be used to treat something as complex as cancer? It's all thanks to a cutting-edge approach called photothermal therapy, or PTT. Imagine this. We inject these gold nanorods into the body, and they travel directly to the tumor site. Then, we shine near-infrared light onto the tumor. The gold nanorods absorb this light and transform it into heat, effectively burning away the cancerous cells. Pretty cool, right? This approach is incredibly precise, targeting only the cancerous tissue while leaving healthy cells unharmed. It's like using a microscopic heat-seeking missile to obliterate cancer. In the following sections, we'll delve deeper into the science behind this amazing technology and discover how gold nanorods are changing the face of cancer treatment. Stay tuned. Now, not just any gold particle can pull off this incredible feat. We need something truly extraordinary, something that operates on a scale so small, it's almost unimaginable. We need something special, something nano-sized. These particles are so tiny that they can interact with biological systems in ways that larger particles simply can't. Enter gold nanorods, specifically those coated with a special material called polyvinyl pyrrolidone, or PVP for short. This coating is crucial because it stabilizes the nanorods and makes them more biocompatible. These PVP-capped gold nanorods are like the Goldilocks of particles. Not too big, not too small, but just right for the job. Their size is optimized to navigate through the bloodstream and reach their target efficiently. How do we know they're the perfect size? Scientists have developed precise methods to measure and confirm their dimensions. Scientists use super cool techniques like dynamic light scattering to measure the size of these nanoparticles. This technique helps us understand how these particles behave in different environments. Imagine shining a laser pointer through a glass of water. You'll see the light scattering all over the place. This scattering effect is similar to what happens in dynamic light scattering. Dynamic light scattering does something similar, using light to determine the size and movement of our tiny gold heroes. By analyzing the scattered light, we can get a precise measurement of the nanoparticle's size. Another important factor is the zeta potential, which tells us about the stability of these nanorods in the bloodstream. This measurement is crucial for ensuring that the particles remain dispersed and effective. A high zeta potential means the particles repel each other, preventing them from clumping together and ensuring they reach the tumor effectively. This repulsion is key to their success in medical applications. It's like giving each nanorod its own personal force field. This protective barrier ensures that the nanorods can travel through the bloodstream safely and reach their target without any issues. You might be wondering, is it safe to put gold inside the body? After all, we're not pirates. Well, it turns out that gold is incredibly biocompatible, meaning it doesn't harm our bodies. That's why dentists have been using gold fillings for years. To ensure these gold nanorods are safe and effective, scientists have tested them extensively in the lab. One way to study their impact is by using a DMBA carcinogenesis model in female rats. Don't worry, no pirates were harmed in the making of this science. This model helps researchers understand how cancers, like breast cancer, develop and respond to treatments like our gold nanorod therapy. The results? The PVP-capped gold nanorods were shown to be safe and well tolerated by the rats. They didn't cause any adverse effects, proving that they can travel through the body without causing any harm. This safety is crucial for any new medical treatment, and these promising results pave the way for gold nanorods to become a game changer in cancer treatment. Section 4. Shrinking tumors, restoring health, the power of PTT. Now for the exciting part, seeing how these gold nanorods actually fight cancer. These tiny particles, when exposed to near-infrared (NIR) light, become powerful tools in the battle against cancer. The science behind it is both fascinating and groundbreaking. In studies using the DMBA model, rats treated with PVP-capped gold nanorods and NIR light showed remarkable improvements. This model is crucial for understanding how treatments can be effective in real-world scenarios. Remember, the light activates the gold nanorods, generating heat that destroys the tumor. This process, known as photothermal therapy, PTT, is a targeted approach that minimizes damage to surrounding healthy tissues. First, the tumors in the treated rats shrank significantly compared to those in the untreated group. The data is clear and compelling, showing a dramatic reduction in tumor size. That's right, the tumors were literally melting away. This visual evidence is a testament to the effectiveness of the treatment. This tumor shrinkage is a clear indication that the gold nanorods, combined with NIR light, are effectively targeting and destroying cancerous cells. But there's more. The precision of this method ensures that only the cancer cells are affected, leaving healthy cells unharmed. The treated rats also experienced improvements in their overall health. They became more active and showed signs of recovery that were not observed in the untreated group. They regained lost body weight, and their organs remained healthy and functional. This holistic recovery is a crucial aspect of the treatment's success. This finding highlights that PTT using gold nanorods not only fights cancer, but also helps the body recover and heal. The dual benefits of tumor reduction and health restoration make this approach particularly promising. These results are incredibly promising, demonstrating the potential of PVP-capped gold nanorods to effectively treat cancer while minimizing side effects. The minimal side effects observed in the studies further underscore the potential of this treatment. It's like giving cancer a 1-2 punch, shrinking the tumor and boosting the body's natural healing abilities. This dual action not only targets the disease but also supports the overall well-being of the patient, making it a revolutionary approach in cancer treatment. Section 5. Turning Light into Heat, How Gold Nanorods Attack Cancer. In this section, we delve into the fascinating world of gold nanorods and their groundbreaking role in cancer treatment. But how do these tiny particles actually work their magic? What makes them so special in the fight against cancer? The secret lies in their unique ability to absorb near-infrared light and convert it into heat. This property is not just a scientific curiosity, it's a game-changer in medical treatments. This process, known as photothermal conversion, is the key to PTT's success. Photothermal therapy, or PTT, leverages this conversion to target and destroy cancer cells with precision. Imagine shining a light through a magnifying glass. The focused light beam can generate enough heat to burn a leaf. The lens focuses the light, creating a concentrated beam that can burn a leaf or ignite a piece of paper. This is a simple yet powerful demonstration of how light can be transformed into heat. Gold nanorods act in a similar way, acting as microscopic antennas that capture near-infrared light and transform it into heat energy. This heat is then used to target cancer cells. This heat is then released directly into the tumor, effectively cooking the cancerous cells from the inside out. But wait, there's more. The precision of this method ensures minimal damage to surrounding healthy tissues. Gold nanorods also take advantage of a phenomenon called the Enhanced Permeability and Retention Effect, or EPR effect. This means that tumors, with their leaky blood vessels, allow nanoparticles like our gold heroes to accumulate within them, making the treatment even more targeted and effective. The EPR effect ensures that the nanorods are concentrated where they are needed most. This combination of photothermal conversion and the enhanced permeability and retention effect makes gold nanorods a powerful weapon in the fight against cancer, delivering a highly targeted and localized heat therapy that can effectively eradicate tumors. Researchers are continually exploring new ways to enhance this technology, making it a beacon of hope for future cancer treatments. Section 6. Proof in the pictures. Seeing is believing. The proof, as they say, is in the pudding, or in this case, the pictures. Scientists use sophisticated imaging techniques to track the movement of gold nanorods in the body and monitor their effects on tumors. These images provide undeniable evidence of the incredible power of PTT. For instance, thermal imaging cameras can capture the temperature changes within the tumor during treatment. These images show a dramatic increase in temperature specifically at the tumor site, confirming that the gold nanorods are effectively absorbing the near-infrared light and generating heat exactly where it's needed. Furthermore, biopsies taken after treatment reveal extensive cell death within the tumor, while surrounding healthy tissue remains unharmed. These images paint a clear picture. Gold nanorods are like microscopic assassins, selectively targeting and eliminating cancer cells with incredible precision. Section 7. A Brighter Future. Gold nanorods leading the way. The future of cancer treatment is looking brighter thanks to the groundbreaking work being done with gold nanorods and photothermal therapy. This minimally invasive approach offers a compelling alternative to traditional cancer treatments like surgery, chemotherapy, and radiation, which often come with debilitating side effects. Imagine a world where cancer treatment is as simple as a quick injection followed by a painless light treatment. That's the promise of gold nanorod-mediated PTT, a future where cancer is no longer a death sentence, but a manageable condition. While more research is needed before this technology becomes widely available, the results so far are incredibly encouraging. Gold nanorods are poised to revolutionize cancer treatment, offering new hope and a brighter future for millions of people around the world. And that's something worth getting excited about.
Rat mammary tumors are often used in research labs around the world. These tumors provide a valuable model for scientists to study the complexities of cancer. By examining how these tumors form, grow, and spread, researchers can gain insights that are directly applicable to human breast cancer. The similarities between rat mammary tumors and human breast cancer are striking, making them an ideal subject for study. Why? Because they closely resemble human breast cancer. The cellular structures, growth patterns, and even the genetic mutations found in rat mammary tumors often mirror those seen in human cases. This resemblance allows scientists to test hypotheses and treatments in a controlled environment before moving to human trials. By studying these tumors in rats, scientists can better understand how cancer develops and spreads in humans. This research is not just about observing the disease, it's about understanding the underlying mechanisms that drive cancer progression. Researchers can manipulate variables in ways that would be impossible or unethical in human studies, providing a deeper understanding of the disease. This knowledge is crucial for developing new and effective treatments. By identifying the key factors that contribute to cancer growth, scientists can target these areas with precision therapies. The ultimate goal is to translate these findings into treatments that can save lives and improve the quality of life for cancer patients. Transmission electron microscopy, or TEM, allows us to see incredibly small details within these tumors. This advanced imaging technique provides a window into the cellular world, revealing structures that are invisible to the naked eye. TEM is essential for understanding the fine details of cancer cell architecture. TEM works by shining a beam of electrons through a thin slice of tissue. As the electrons pass through the sample, they interact with the tissue, creating an image that can be magnified to show intricate details. This process allows scientists to see the inner workings of cells and tissues at a molecular level. The electrons interact with the tissue, creating an image that shows us the intricate structures inside cells and tissues. These images are not just pictures. They are detailed maps that guide researchers in their quest to understand cancer. Each micrograph can reveal new information about how cancer cells differ from normal cells. These images, called micrographs, reveal the often subtle changes caused by cancer. By comparing healthy and cancerous tissues, scientists can identify the specific alterations that occur during cancer development. This information is vital for developing targeted therapies that can address these changes. In this essay, we'll journey into the microscopic world of rat mammary tumors, focusing on the effects of a potent carcinogen called DMBA. DMBA is used to induce tumors in rats, providing a consistent model for studying cancer. By understanding how DMBA causes cancer, researchers can develop strategies to prevent and treat the disease, and a promising treatment using gold nanorods and laser light. This innovative approach uses tiny particles of gold to target cancer cells. When exposed to laser light, the gold nanorods heat up and destroy the cancer cells without harming surrounding healthy tissue. This method holds great promise for the future of cancer treatment, offering a less invasive and more precise option for patients. DMBA, short for 7,12-dimethylbenzanthracene, is a powerful carcinogen. This chemical compound is often used in scientific research to study cancer mechanisms because of its potent ability to induce tumors. Understanding how DMBA works can provide valuable insights into the processes that lead to cancer development. When introduced to rats, DMBA causes significant changes in the mammary glands. Researchers have observed that even small doses of DMBA can lead to noticeable alterations in the tissue structure. These changes are critical for studying how cancer initiates and progresses in living organisms. Often these changes lead to tumor development. The tumors that form in the mammary glands of rats exposed to DMBA are similar to those found in human breast cancer, making this an important model for cancer research. By studying these tumors, scientists can develop better strategies for prevention and treatment. One of the first signs of DMBA's impact is visible in the blood vessels supplying the tumors. These blood vessels undergo significant changes that can be observed under a microscope, providing early indicators of tumor development. Normal blood vessels are smooth and uniform, allowing for efficient blood flow. This regular structure is essential for maintaining healthy tissue function and ensuring that cells receive adequate oxygen and nutrients. However, DMBA causes these vessels to become twisted and irregular. This irregularity disrupts the normal flow of blood, which can lead to a variety of complications in the affected tissue. This abnormal blood vessel development is a hallmark of cancer. The twisted and irregular vessels are not just a symptom but also contribute to the progression of the disease by creating an unstable environment within the tissue. It disrupts the normal flow of oxygen and nutrients to the surrounding tissue. This disruption can cause the tissue to become hypoxic or deprived of oxygen, which further promotes cancer cell survival and growth. This creates a favorable environment for tumor growth and spread. The altered blood vessels and disrupted nutrient flow make it easier for cancer cells to thrive and invade surrounding tissues, highlighting the importance of targeting these changes in cancer therapy. Examining tumor blood vessels under a TEM reveals even more unsettling changes. The intricate network of blood vessels within a tumor is far from normal. Under the high magnification of a TEM, or transmission electron microscope, we can observe the minute details that are often missed by other imaging techniques. The cells lining the blood vessels, called endothelial cells, appear swollen and disorganized in DMBA-induced tumors. This disorganization is not just a random occurrence. It is a hallmark of the chaotic environment within the tumor. The swelling of these cells indicates a response to the abnormal conditions created by the tumor's rapid growth and metabolic demands. These structural abnormalities further compromise the integrity of the blood vessel wall. The walls of these vessels are often weakened, making them more susceptible to rupture. This compromised state can lead to leakage of blood and other fluids into the tumor, which can exacerbate the already hostile environment. This makes it easier for cancer cells to break away from the tumor and travel to other parts of the body, a process known as metastasis. Metastasis is one of the most dangerous aspects of cancer, as it allows the disease to spread and affect multiple organs. The disorganized and weakened blood vessels provide a pathway for these cells to enter the bloodstream and colonize new areas. The changes in blood vessels seen with DMBA exposure highlight the significant impact this carcinogen has on the tumor microenvironment. DMBA, or 7,12-dimethylbenz anthracene, is a potent carcinogen used in research to induce tumors. Its effects on the blood vessels within the tumor are profound, leading to the structural and functional abnormalities we observe. It sets the stage for aggressive tumor growth and spread. The compromised blood vessels not only facilitate metastasis, but also support the tumor's own growth by providing it with the necessary nutrients and oxygen. This vicious cycle of growth and spread underscores the importance of understanding and targeting the tumor microenvironment in cancer therapy. The damaging effects of DMBA are not limited to blood vessels. Inside the cells themselves, DMBA wreaks havoc on the delicate machinery of life. The most obvious target is the cell's nucleus, the control center that houses its DNA. In DMBA-exposed cells, the nucleus often appears enlarged and misshapen. The normally distinct boundary of the nuclear membrane, which protects the DNA, can become fragmented and irregular. These changes reflect the genetic damage inflicted by DMBA. In the fight against cancer, researchers are constantly seeking new weapons. One promising avenue involves tiny particles called gold nanorods, or AUNRs. These minuscule rods, far thinner than a human hair, possess a unique ability to absorb light and convert it into heat. When coated with a biocompatible polymer called PVP, or polyvinyl pyrrolidone, AUNRs can be delivered directly to tumor sites. This targeted approach forms the basis for a potential new cancer treatment. The next step in this innovative treatment involves near-infrared, or NIR, laser irradiation. NIR light can penetrate deep into tissues without causing significant damage to healthy cells. When this laser light is directed at the tumor containing gold nanorods, something remarkable happens. The gold nanorods absorb the NIR light and rapidly convert it into heat. This localized heating effect can destroy the tumor cells from the inside out, while sparing the surrounding healthy tissue. When researchers combined DMBA-induced tumor treatment with PVP-capped gold nanorods and NIR laser irradiation, the results were encouraging. The TEM images told a compelling story of tumor destruction. The tumor cells showed clear signs of damage, including shrunken nuclei and disrupted cell structures. This indicated that the combined treatment was effectively killing the cancer cells. Throughout this journey into the microscopic world of tumors, we encountered several abbreviations. DMBA, which stands for 7,12-dimethylbenzanthracene, a potent carcinogen. AUNRs, referring to gold nanorods, tiny rods used for targeted therapy. PVP, polyvinyl pyrrolidone, a biocompatible polymer used to coat the ONRs. NIR, near-infrared, a type of light used to activate the ONRs. And TEM, transmission electron microscopy, a powerful imaging technique. Understanding these abbreviations is key to unlocking the meaning behind the research and appreciating the potential of this innovative cancer treatment. The findings from these TEM studies offer a glimpse into the future of cancer treatment. Using nanoparticles like gold nanorods in combination with targeted laser therapy holds great promise for developing more effective and less invasive cancer treatments. While more research is needed to translate these findings into clinical practice, these tiny images offer a powerful message of hope for cancer patients worldwide.
Hey there, science fans, where we delve into the wonders of the microscopic world. Today, we're diving into the exciting world of nanotechnology, a field that's revolutionizing science and technology as we know it. In this realm, scientists work with materials at the tiniest level imaginable, manipulating atoms and molecules to create new structures and devices. We're talking billionths of a meter. That's right, we're dealing with dimensions so small, they're almost beyond comprehension. Get ready to explore gold nanorods, or AUNRs for short. These tiny structures are making big waves in the scientific community. These microscopic marvels are like tiny golden rods, each one just a few nanometers in diameter, and up to hundreds of nanometers long. And they hold enormous potential in various fields, especially medicine, where their unique properties can be harnessed for innovative treatments. You might be wondering why gold? What makes this precious metal so special in the world of nanotechnology? Well, gold is chemically inert, meaning it doesn't react easily with other substances. This stability is crucial for applications inside the human body. This makes it a safe choice for biomedical applications, ensuring that it won't cause unwanted reactions when used in medical treatments. But the real magic of AUNRs lies in their shape and size. Their elongated form gives them unique optical properties. These tiny rods interact with light in fascinating ways, absorbing and scattering light differently than spherical nanoparticles. This makes them incredibly useful for imaging and treating diseases. For instance, they can be used in photothermal therapy to target and destroy cancer cells with precision. So, stay tuned as we uncover more about these golden wonders and their potential to change the future of medicine and technology. Exciting times are ahead. Creating gold nanorods is like following a precise recipe. Scientists use a method called seed-mediated growth, where tiny gold seeds are coaxed into growing into rod-shaped nanoparticles. This involves mixing gold salts with special chemicals that control the size and shape of the resulting nanorods. The process is a bit like gardening at the nanoscale. Scientists carefully adjust the growth solution to ensure the nanorods grow to the desired dimensions. It's a delicate process that requires precision and expertise. Once the gold nanorods are synthesized, the next crucial step is to thoroughly examine their properties and characteristics. Scientists need to examine them closely to ensure they meet the desired specifications for their intended applications. This is where characterization techniques come into play. These techniques are essential for understanding the physical and chemical properties of the nanorods. These techniques help scientists see the nanorods, even though they're far too small for the naked eye. Advanced microscopy methods allow for detailed visualization at the nanoscale. One commonly used technique is UV-vis spectroscopy, which analyzes how the nanorods absorb and scatter light. This method is particularly useful for determining the optical properties of the nanorods. This helps determine their size and shape, which are critical factors in their performance in various applications, such as medical imaging and photothermal therapy. Transmission electron microscopy (TEM) allows scientists to see the nanorods directly by beaming electrons through them. This technique provides high-resolution images that reveal the fine details of the nanorod's structure. X-ray diffraction (XRD) reveals information about their crystal structure. Understanding the crystal structure is vital for predicting the nanorod's stability and reactivity. Dynamic light scattering (DLS) measures their size distribution in solution. This technique is essential for ensuring uniformity in size, which can affect the nanorod's behavior in different environments. And zeta potential analysis tells us about their surface charge, which is important for their stability and interactions with other molecules. A stable surface charge can prevent aggregation and improve the nanorod's performance in various applications. By employing these diverse characterization techniques, scientists can gain a comprehensive understanding of gold nanorods, ensuring they are well suited for their intended uses, from medical treatments to advanced materials. Scientific breakthroughs rarely happen in isolation. This research on gold nanorods is a testament to the power of collaboration. Teams of dedicated scientists from different disciplines, including chemistry, materials science, and biomedicine, work together to synthesize, characterize, and explore the potential applications of AUNRs. Each team member brings their unique expertise to the table, fostering a dynamic and productive research environment. Imagine the brainstorming sessions and the excitement of sharing new discoveries. Collaboration is key to pushing the boundaries of scientific knowledge. Section 5. A Tribute to a Mentor. Dedication to Professor El-Sayad. This important research is dedicated to Professor Hassan I.H. El-Sayad, a renowned scientist and mentor who has made significant contributions to the field of nanotechnology. His guidance, support, and inspiration have paved the way for countless young researchers. Professor El-Sayad's legacy extends beyond his groundbreaking research. He is also known for his unwavering commitment to fostering the next generation of scientists, instilling in them a passion for discovery and a dedication to scientific excellence. Section 6. Transparency and Trust. The cornerstones of scientific endeavor. In the pursuit of scientific knowledge, transparency and integrity are paramount. This research on gold nanorods upholds the highest ethical standards, ensuring that the findings are reliable and trustworthy. All experimental procedures, data analysis methods, and potential conflicts of interest are disclosed openly and honestly. This commitment to transparency fosters trust within the scientific community and among the public, ensuring that the potential benefits of this research can be fully realized. Section 7. Shaping the Future of Medicine. The Impact of AUNR Research. The unique properties of gold nanorods make them ideal candidates for a wide range of biomedical applications. One particularly promising area is nanomedicine, where AUNRs are being explored for their potential in diagnosing and treating diseases like cancer. Imagine tiny gold nanorods acting like guided missiles, delivering drugs directly to cancer cells while leaving healthy cells unharmed. This targeted approach could revolutionize cancer treatment, making it more effective and reducing side effects. Section 8. Gold nanorods in action. Photothermal therapy for cancer. One exciting application of gold nanorods is in photothermal therapy, a cutting-edge cancer treatment that uses light to destroy tumor cells. When gold nanorods are exposed to near-infrared light, they absorb the light energy and convert it into heat. This heat can then be used to selectively kill cancer cells. This localized heating effect minimizes damage to surrounding healthy tissue, making photothermal therapy a promising alternative to traditional cancer treatments like chemotherapy and radiation, which can have significant side effects. Section 9. Looking ahead, a bright future for nanomedicine. As we stand on the brink of a new era in medical science, the potential of nanomedicine is nothing short of revolutionary. Imagine a world where diseases are not just treated but anticipated and prevented with pinpoint accuracy. As we continue to unlock the secrets of gold nanorods and other nanomaterials, the future of nanomedicine shines bright. These tiny particles, invisible to the naked eye, are opening doors to medical possibilities we once only dreamed of. Researchers are tirelessly working in labs, pushing the boundaries of what we know and what we can achieve. With ongoing research and development, AUNRs hold immense potential to transform the way we diagnose, treat, and monitor a wide range of diseases. The precision and efficiency of these nanomaterials could lead to breakthroughs in early detection and personalized treatment plans, making healthcare more effective and accessible. From targeted drug delivery to non-invasive imaging techniques, the applications of gold nanorods are vast and varied. Imagine a future where medications are delivered directly to affected cells, minimizing side effects and maximizing efficacy. Non-invasive imaging could revolutionize how we see inside the human body, providing clearer, more detailed pictures without the need for invasive procedures. And innovative cancer therapies, Gold Nanorods are poised to play a pivotal role in shaping the future of healthcare. These advancements could lead to more effective treatments with fewer side effects, offering hope to millions of patients worldwide. The fight against cancer could see a new dawn, with nanotechnology leading the charge. It's a thrilling time to be a science enthusiast, as we witness these groundbreaking developments unfold. The excitement in the scientific community is palpable, with each discovery bringing us one step closer to a healthier, more advanced world. And I can't wait to see what incredible discoveries await us in the world of nanotechnology. The journey ahead is filled with promise and potential, and together, we are on the cusp of a brighter, healthier future. Welcome back to For Science Salah Lotfy channel. Today, I have something super exciting to share. A groundbreaking study titled, A New Vision of Photothermal Therapy, assisted with Gold Nanorods for the Treatment of Mammary Cancers in Adult Female Rats. This is a huge leap forward in nanotechnology-driven cancer therapy. This exceptional research was published in the prestigious journal Nanoscale Advances, Issue 1 of 2024. It dives deep into how gold nanorods can be used in photothermal therapy to combat mammary cancers. Fascinating, right? Now let's give a shout out to the brilliant minds behind this work. First up, we have Professor Walid Tawfik, an expert in laser spectroscopy and ultra-fast lasers, leading the Department of Laser Applications in Metrology, Photochemistry and Agriculture at the National Institute of Laser-Enhanced Sciences, NILES. Next, Professor Heba Mohamed Fahmy, an Associate Professor of Biophysics at the Faculty of Science, Cairo University. Then there's Dr. Hend Gamal, a dedicated researcher from the Department of Zoology, Faculty of Science, Mansoura University. We also have Dr. Ahmed N. Emam, from the Nanomedicine and Tissue Engineering Research Lab at the National Research Center, Cairo, Egypt. And let's not forget Professor Dr. Heba Atef El-Ghaweet, a professor of experimental embryology at the Faculty of Science, Mansoura University. Lastly, we honor the late Professor Hassan El-Sayed, whose profound legacy in experimental embryology is celebrated through this study. A big thank you to this incredible team for their outstanding contributions. This collaboration is a perfect example of the power of interdisciplinary science, combining expertise in laser applications, biophysics, nanomedicine, and embryology to revolutionize cancer treatment is nothing short of inspiring. Before we wrap up, I want to extend my heartfelt thanks to these researchers for their remarkable efforts and dedication to advancing science. And to you, my valued viewers, thank you for your continued support. Drop your thoughts about this research in the comments below. Your engagement fuels our drive to bring you the latest in scientific discoveries. Don't forget to like, share, and subscribe to For Science Salah Lotfy channel for more inspiring content. Until next time, stay curious and keep exploring.